Under the leadership of Pat Garrity, Florida Blue's president and CEO, Florida Blue is leading a comprehensive approach to prioritize access to behavioral health and improve social connection during these challenging times, as well as ensuring access to testing and treatment for COVID-19. Florida Blue has also pledged $2 million to support the critical needs of local communities. To share more about these efforts, we're now joined by Dr. Kelli Tice-Wells, Senior Medical Director of Medical Affairs at Florida Blue.
Good afternoon, everyone. It certainly is a pleasure to be with you today. And I have to say that one of the things that is helping as we move through this, I understand that because this is new, we are literally building a plane while in flight. And what I've found to be of tremendous value is the opportunity to come together and talk about our shared experience and leverage the insight that other experts have. And so I'm so thrilled to have had the opportunity to hear from my co-presenters. The information is extraordinarily valuable. And having done some work in the areas of social determinants, one of the things that I am critically and urgently aware of is the impact of those issues in the setting of an intense new stressor. So, pre-COVID, we talked about concentrated poverty and financial toxicity that occurs. And now we've added a situation that disrupts normal social chains and has increased that financial strain. There is an urgency with which we must respond to this for members of our communities in order to be sure that we can prevent what really could be catastrophic outcomes. So I'll talk a little bit about what we have done at GuideWell and Florida Blue. And I want to talk specifically about some things we did for our employees, and then I'll talk a little more specifically about what we've done for members. It's clear that our employees, we have a company that employs more than 14,000 people, and our employees become a population that we manage, both in terms of their health, as they are, many of them are members of our own employee group, but also their day-to-day stress, their awareness. We have responsibility for them, and I'm happy to say that we take that seriously and really treat them as the first and primary population that we want to try to address. And as a health solutions company, we decided early on that it was information, and clearly presented information, updated often. That was going to be our key to ensuring that our members and our employees felt supported. We know that our employees want to feel seen and heard, and we also know that to be true for our members. So how do you take 14,000 people and move them home? It was quite an undertaking, as you might imagine, and our goal as an enterprise was to ensure that we were ahead of the curve in terms of making that transition. So we pulled the trigger early in trying to address the needs of a large employee population and support them as they transition their work setting. And we discovered a lot. One of the things that I have shared over and over is that much of what we are addressing in our communities and in our members in terms of social determinants exists in our employee population as well. So right away we noted that there were those who wanted to work from home and couldn't because they did not have appropriate internet connectivity. There were those who didn't have proper equipment. There are, many more that don't have a quiet office type space to work in than there are those that do. And so we had to make allowances for and adjustments for all of those things. At the same time, we've got folks who, as was mentioned, have now become their child's primary educator. And so we had to make some adjustments in terms of allowing employees to shift their work schedule, adjust productivity, at least initially, in order to allow them to incorporate these new requirements into their work days. And we were very specific and detailed with how we did that. And we surveyed our employees very early in the process. to try to be certain that we understood what was important to them. One of the things I think that contributes to isolation is, a feeling of disconnection. So the physical disconnection is one thing, but to feel disconnected in terms of thought processes, prioritization of information and issues is also very important, and it's a huge driver of the disconnects that can exist between employees and management. So we surveyed our employees, and then we were intentional about responding to what we got back. We made concessions in terms of folks' availability. We have people who are working split shifts and that sort of thing in order to try to meet their productivity goals. And then we quickly had to make specific plans for certain subsets and groups. We've got contractors, we've got sales employees, we have clinicians, we have customer support personnel, and all have a slightly different set of needs. We also wanted to be certain during this time that we leveraged and maintained a great rapport and relationship with our employees. And the primary reason for that is we wanted, as we want for our members, we want to be seen as a trusted advisor. We wanted our employees to feel comfortable reporting illness to us, reporting worrisome exposures, so that could be managed and so that we could ensure that they and their colleagues were kept safe from the spread of infection. We also addressed very directly the potential stigma of diagnoses and made certain that we created a dialogue that was comfortable and easy on a one-on-one basis with employees, and that any information shared in managing that and follow-up was de-identified and protected the employees' identities. Also, we had to acknowledge and then address that the policies put in place, for instance, for paid time off related to COVID-19 were useful, but we had a number of employees who had very low balances, and so we moved quickly to address those that had less PTO and made put some quick policies in place to be sure that folks felt confident that they could have paid time off if they became ill, rather than have them feel like they needed to sort of push through. We also quickly identified funds that could be leveraged to assist employees who were in need should they, again, have issues related to new financial impacts. We've been intentional, too, about demonstrating our commitment to employees. So, and you'll see through the remainder of my presentation that we have focused on video conferencing and video messaging as an important part of our communications methods, both to members and employees, again, to try to establish a more personal interaction versus the things that are, sort of printed and written material that gets pushed out by email or posted on the website. Again, trying to ensure that folks feel connected to leaders and they can hear from the leaders' own mouths their concerns being met, addressed, and validated. We also have leveraged relationships with members of our teams that would have been impacted as we moved 14,000 people into a work-from-home status. Our cafeterias and the productivity of those areas was significantly impacted. And there would have been difficulty trying to maintain work for that group of employees that were our food staff. What we did, however, was that we did a couple of things that kept them working, and that was we partnered with local food banks and did food preparation for our community, producing now 3,000 meals a day out of our cafeteria kitchens. And the other thing we did was we built very quickly a menu of to-go items that can be purchased by our employees at significantly discounted rates. So ready-to-go meals. So you can purchase meals for a family of 4. You order it online, and then you drive through and pick it up. And also very, very early on, we established that they could also purchase household essentials through the same manner. And I can tell you, given the limitations of things like toilet paper early on, we were certainly a great resource for at least a few of our employees. Now, I want to be certain that, we have to talk about benefits, right? And we did what we should do related to benefits. That was not the heavy lift. Communicating the changes, however, is quite important. And we have created messaging, revised messaging, relaunched messaging, and provided a number of different fora for our members and employees to ask us questions about their coverage and benefits. And that's really key, because this landscape has changed so quickly. And often what they're seeing in the news and what they're hearing or seeing from us may be a bit different. And so we wanted to be quite intentional about providing them opportunities to ask specific questions. On this slide, I'll highlight the last two bullets, and that is that we, again, in trying to be sure that we engaged folks in one-on-one conversation. For our members, we use our nurses and our social workers, some of whom had been transitioned out of face-to-face interactions into a more virtual setting. We engage them to proactively reach out to members, check on their health, help with food and rent and utilities and those kinds of things, because we have a team of social workers that were already engaged in that work. The other thing that we do is, any member who has a COVID diagnosis does get a call from us in order to ensure that they have what they need, both to complete their isolation and quarantine period and in order to connect to whatever services might be indicated. And then finally, very early on, we launched a toll-free hotline that's staffed 24 hours. That's not just for our members, but, open to anyone in the community who might feel the need to engage and connect to get some assistance with stress management. We began to hear very early on just how anxious our members were about what they were seeing and their own fears about their health as the number of cases across the country began to increase. I've spoken about how we really work to make personal connections with our employees and members, and I want to preface what I'll say about our webinar strategy with the fact that we did do surveys of our members as well, and we have paid attention to the questions that are being asked. So we created a forum that allows for review by our interdisciplinary teams, what questions are being asked by members and what answers are being provided in order to be sure that we're responding with clarity, and that if there are questions that we have not well addressed, that we can incorporate that information into other communications and other activities that touch members. Finally, I think it's key that we acknowledge the fact that, in this situation, we may have the same question asked many times. And I think that is, some of it has to do with the anxiety that members are feeling, but a lot of it has to do with a feeling of wanting to hear their specific question answered, right? So rather than read a bit of information and glean from that information what applies to me, a one-on-one response, I think members are finding quite valuable, and so we explore ways we can accomplish that. And so our webinars are one of the tactics that we use, and we've now done 8 hour-long webinars that have evolved over the course of the COVID response. Initially we covered very general content, and now we are much more targeted and specific in what we share in those webinars. And each session is concluded with a long Q&A session where participants can introduce their question into a chat box. The moderator will read the question. We get to as many as we can get to during the allotted time, but all of the questions that are in queue at the time that we disconnect are provided for response, and then that goes back out to all participants so that everyone, again, has the opportunity to feel as though their question was heard. We also use multiple channels to distribute our video messaging, and we use small snippets. So, we did specific things about hand washing. We talked about social distancing. one at a time, to allow, again, consumption of information in a way that was easy and actionable. We didn't want critical information to be buried in a list of new things to do. We also found very early on that our members were falling victim to some scams. There is a great deal of that going on now. So we began to monitor that, and we put out specific messaging to our members related to that to try to help keep them safe. That's certainly a way that we can help them avoid stress and feeling more disconnected if something untoward like that were to occur. You can't have a conversation about healthcare without talking about specific at-risk populations. And we very early on recognized that as elective procedures were postponed, there were a number of members who were not seeking services because they were fearful and did not understand how to access their care provider during these changing times. We polled all of our providers, called every one of our provider offices in our network, and assessed their status. Are you open? Are you closed? Are you doing virtual services? Do your patients know? And we compiled that information and began to address certain groups of patients in order to be sure they had actionable information. Again, we wanted to be sure that they were connected to care. We also very specifically called out the groups who had chronic disease diagnoses that we knew put them at risk for catastrophic consequences from COVID-19 infection, and we created messaging directly for those groups. And we talked specifically about what it is you should be doing in this moment in order to protect yourself. And I think the other thing that is key is we've had the opportunity to specifically address fear and its impact. And we do so in plain language, hoping that we can then arm people with the information they need to really sort of relax and relieve some of those fears, but continue to encourage them to connect into care. I have a grave concern as we talk about disparities of seeing a host of preventable complications from chronic disease that directly correlate to this period of time because people are so reluctant to seek services. We can't rely on people's intuition at this moment. We have to really speak in plain language and outline for them what it is we're trying to address and why. The final population that I'll talk about in this last slide is the seniors. We have grave concern about the older members of our population for obvious reasons. And that's specifically related to the infection itself, but more primarily and more critically is the work that was already in flight to address social isolation issues in our Medicare population. And, the advice that I have here is, be certain as you look around to partner with organizations in order to achieve goals like this, choose a partner whose mission is in alignment with what the messaging is you're hoping to advance. And so in our case, we had long partnered with the Council on Aging, and were able to leverage that relationship to craft some specific messaging and host some events, which allowed us to speak specifically about some of the issues that the older folks in our community face. Again, I will say, being very specific is probably the most important thing. And one of the things we gathered very quickly in some of those first conversations was just how difficult it was for many of our seniors to make the transition to a more digital, virtual way of receiving services and care. And I'll say that, having, and my dad keeps telling me to stop talking about him in my presentations, but having walked an 80-year-old through the download of an app for grocery delivery, it took the better part of a week. I fully understand the need for us to move the ability to provide that support into a virtual capacity. So through a program partnership that already existed with a program called PAPA, the PAPA program, I sort of affectionately refer to it as the grandchild program, right? It's geared toward addressing social isolation, but what you get is a grandchild, a young person who comes by and helps. It may be, chores at home. It may be simple companionship or playing a game. but it's connection. And very organically, when you create something like that for the senior population, those young folks begin to, fix the television remote and help with some of those digital things. And so that program now is fully virtual, and we continue to provide support to seniors in that tangible manner, which I think is just critical for them. We have a number of employees with older parents who are out of state, and we want to continue to leverage things like that in order to have them feel connected and supported. We, again, are very, very specific in what we do related to that. And I'll close with, just, again, a final concern, and we're working to address this, but it is certainly top of mind for me, and that is food insecurity. As supply chains were interrupted, and as our routines were interrupted, as restaurants shifted their business or closed entirely, the sources for a lot of the supplemental food services in our communities literally went away. And we have had to step in and try to address that in a manner that keeps folks out of crisis. That was the case certainly with school children, for whom some percentage of them, those are their only meals of the day. We had to do the same thing for our seniors, and so we've tried to be very intentional about the connections that we could make with organizations like Meals on Wheels to be sure that we could keep those things spinning for our senior population, for whom meal delivery and even momentary connection with someone were critically important, both from a nutrition standpoint, but also from a personal interaction standpoint. I'll stop there. Thank you so much.